Hi, we are doing a Facebook Live session. My name is Dr. Andrew Lerman. I'm a board-certified neurologist and epileptologist in the Miami, Coral Gables area. And we've been getting a lot of questions from our colleagues and patients alike regarding what's going on in the community and what's going on in the neurological and epilepsy realm right now in the setting of the COVID crisis. We will start off by opening the floor for questions. If anyone out there would like any questions answered, we are here and available to answer any questions. We'll start off with some questions that we've been getting from our patients, common questions and concerns regarding epilepsy, as well as all comers in terms of neurological disease, medications that people are talking about, both in the news as well as patients that take medications for neurological illness at present time and are concerned about their risks compared to everybody else and in general. So we'll hold on for a second and wait for some questions to come in. And again, I hope all of you are being safe. I hope you're social distancing. And I hope everybody's practicing safe hygiene, hand washing, very important right now. We are here live, and we are trying to convert as many patients to telehealth as possible in this time period in order to provide the safest continuity of care possible. So, who is at risk for COVID infection in general? We're all at risk. This is obviously a significant social concern for our community. We know that this is uncharted territory, and that we are learning more and more about this illness on a day-to-day basis. We know that patients who are older than 60 may be at higher risk for developing more severe symptoms than younger patients. However, we are seeing younger patients with some complications as well. It's a little less frequent, and again, we're still compiling data on this, but for the most part, we all need to be super careful. We need to be separating ourselves from the older population if possible, within our houses, within our family structures, in order to prevent spread and prevent complications. We believe that children may be at lower risk based on data that's coming from Europe as well as from China, but still cautiously proceeding and trying to protect everybody, as there may be asymptomatic carriers of the illness, and trying to limit the exposure. Hence our efforts right now and the plea from the medical community to really be consistent and compliant with the social distancing, as this seems to be the only thing that we could do at the moment to prevent spread. A question came in. Are there different seizure types that may be more susceptible to COVID-19 and complications related, and does this illness lower your seizure threshold? The question, is a great question. To answer that in a general manner, patients who are exposed to viral illness, including, and develop fevers, may be at higher, and have epilepsy, may be at higher risk for developing breakthrough seizures. There are certain seizure types, including mainly children, who have predisposition to febrile seizures, who, in the setting of viral illness, may develop fever and may be at higher risk to have breakthrough seizures. That we know of, there's no seizure type that is at higher risk at present time. But patients in general with seizure disorder, it's very important to manage symptoms of the illness aggressively. That brings up the question of NSAIDs that has been kind of floated around in the community lately about the use of NSAIDs and their safety in this situation. There was a lot of misinformation out there on the internet, and patients were concerned, both in the pediatric and adult realm, regarding NSAID use. And really, there's no confirmed data to support that avoiding NSAIDs in this period of time and for seizure patients in general should be pursued. Obviously, speak to your treating neurologist and seizure doctor or care team, but it's certainly recommended to treat fever aggressively, as fever itself can provoke lower seizure threshold and provoke breakthrough seizures. The name of the game right now is really to prevent our patients, my patients, all of our patients in the community from having to attend emergency rooms, ERs, overwhelm our healthcare system, develop, complications related, and be exposed. So NSAID use, in my opinion, should be done judiciously in general right now as well. But if you do develop cold or flu-like symptoms and you're developing fever, it is okay to take NSAIDs, Tylenol, as well as ibuprofen and so forth. Another major concern for our patients in terms of susceptibility in epileptics and in our neurological patients in general is compliance with medications. And right now, more than ever, it's very important that you do not run out of your medication, that you continue to take all our normal precautions in terms of seizure prevention, such as maintaining good sleep hygiene, maintaining your compliance with medication regimen, and really trying not to miss doses of medication. If you're running out of medication, please notify your doctor ahead of time. A lot of offices are being overwhelmed with phone calls, overwhelmed in general with a lot of the issues surrounding COVID and our current healthcare crisis. So get out ahead of it, call your doctor, notify your healthcare team, speak to your primary if you can't get through, but certainly have medication available to you so that you can continue to take your medication without fail and without any gaps, because in general, medication noncompliance is one of the bigger reasons for having breakthrough seizures. Kids with Dravet syndrome, we treat adults as well, may be at higher risk right now for seizure breakthrough. And again, very important to continue close follow-up with your treating epileptologist or physician, and again, no gaps in care. And in order to do that, again, a lot of offices are providing telehealth services. In our office, we've had this in place for quite some time now. We are, having our staff reach out to as many patients as possible in order to keep everybody as safe as possible right now, and try to avoid close contact with other patients and with in both symptomatic as well as asymptomatic, and we're converting as many people as possible to telehealth. It's super important that you remain in contact with your neurologist and your healthcare team, and telehealth is a remarkable way of doing it. And thanks to our government and healthcare providers, we've been able to to open this up to Medicare patients as well as pretty much all insured patients in general. So another question came in, would getting coronavirus increase seizure risk? If so, should seizure medicines be increased? The answer to that question is really you should not make any medication changes on your own. This should be discussed with your neurologist, epileptologist. If for some reason you can't get a hold of your primary care physician, but really in close contact with your neurologist. In general, I would not make this recommendation to empirically increase medication doses right now as a prophylactic measure. I think that, again, if there's breakthrough seizures or there's issues that have arisen in this setting, that's another issue, and you really, that's a case-by-case issue, and you really need to talk to your treating doctor about that. And again, access to healthcare is of utmost importance right now, and we're taking this very seriously and opening up office hours as much as we can. Also, increasing doses of medication on your own could be quite dangerous. There's drug-drug interactions, there's sedative effects of a lot of these medications. It could even affect your respiratory status. And some of those side effects could even mimic viral symptoms. So really this should be taken very seriously, and should only do this under the care of your treating doctor. If a patient does have increased seizure frequency, that would be something that would require at least a phone call to your physician for guidance, but also potentially a visit to the hospital. But again, we're trying to remain as available as possible, and all doctors that we've been talking to, both in our group in First Choice Neurology, as well as community doctors, are doing their best right now to provide that service. Could COVID trigger a seizure if you've been seizure free for many years? We don't really know. Again, this is uncharted territory. There's not enough data yet to fully give my opinion on the neurological consequences of this illness. We have no data to suggest that this strain has a higher likelihood of causing viral meningitis or encephalitis. There has been some anecdotal report lately coming out of some of the other countries that have had a higher disease burden, that there may be some neurological repercussion, and again, some anecdotal reports of viral meningitis. Be aware of this. I think that it's too early to tell, and we will be monitoring very closely and reviewing the literature as it comes out. But if you are concerned about this, call your doctor, get a televisit immediately, and hopefully address the issue, and your physician or healthcare provider can guide you as to whether you should go get assessed immediately, or what to do in that situation. In the hospitals, we're beginning to see some patients with COVID-19 and beginning to learn about some of the things we need to watch out for. So definitely try to stay healthy right now, stress-free, and good sleep hygiene, good hand washing, and simple things right now that we can recommend. Another question just came in, great question. Are epilepsy patients at higher risk of SUDEP with exposure to COVID-19. Again, there is limited data right now, but some theoretical evidence that viral infection could increase the risk of SUDEP, or that a viral infection in general could lower seizure threshold and in turn increase risk for SUDEP. The virus can infect neurons that are part of the brain's control of seizures, as well as cardiac control and respiratory function, and it could cause significant respiratory symptoms, as we all know, which in turn could increase mortality rate. So we definitely, as a medical community, we need to report this if we see it. Hopefully we will not see this, but we need to have a good reporting system, which we do for SUDEP. And the other question was, are children at higher risk? We just don't know yet. Higher risk for SUDEP, we just don't know at this time. And for children, we're going to, cautiously extrapolate whatever data we see in the adult population, which seems to be more affected right now, and not to scare anyone at this point, but we just don't know. But the feeling is that again, we need to cautiously proceed and monitor closely, and again encourage everything that we've previously encouraged our patients to do in order to prevent seizures and repercussions related. Another question here is, how can patients be proactive? And we're all watching the news. We're watching our news feeds on our phones and our TVs, as well as social media, and we know that there is a strong urge from us who take care of patients daily, both in the office and the hospitals, that we practice social isolation and really responsible behaviors right now in terms of hygiene, and trying to really mitigate the spread of this illness for in our community. And the way to do that is to remain isolated right now to the best that we can. I think that if you're have mild symptoms, to try to isolate yourself from family members within your home, as well as really try not to go outside right now. We're in a very early critical period within this healthcare crisis, and we need people to stay at home so that we can keep our hospitals functioning, preserve our resources, preserve the health of our healthcare providers, and get this thing under control as soon as possible, so that we can go back to our normal concerns regarding health. Another question just came in. Do antiepileptic drugs modulate immunity? That is a great question. Older anti-seizure medications such as Dilantin and carbamazepine have been known to cause some bone marrow suppression and decreased production of white blood cells, the main actors in fighting infection, as well as red blood cells, and are both very important in our health and in fighting disease. So yes, this is a concern if you are using some of these older agents. Drug level monitoring, in addition to labs that check for suppression, should be continued, and as per usual, should be monitored closely by your treating physician. Patients should certainly not stop taking medications that control their seizures. It is of utmost importance that you continue all medications at present time, and it's way more important to control your seizures versus a potential risk of developing illness. And this goes for a lot of medications within the neurological realm, including all our immunomodulatory therapies that we're giving patients to treat multiple sclerosis, as well as chronic inflammatory demyelinating polyneuropathy. So it's right now recommended to stay on all medications to treat these conditions and keep them at bay, and again, practice the safest hygiene possible. Medications, here's another question, very good question, regarding some medications that we may be exposed to right now at higher frequency to treat symptoms related to viral illness, cold medications, over-the-counter medications. There's been some talk about recent data on Plaquenil and azithromycin. First, I'll address the cold medications and briefly discuss medications in general that can lower seizure threshold. So medications that contain pseudoephedrine, so Allegra D, or some of the medications that contain stimulant medications, anything with D in it, should not be taken, in fact. These can certainly lower your seizure threshold, and significant precautions should be taken, and really check with your physician before you take any type of new cold medication. Dextromethorphan, some data on, or there's been some sensitivities by my seizure patients to antihistamines. Antihistamines there's a lot of mixed opinions on antihistamines, but certainly discuss that with your treating doctor. But some antihistamines may, in fact, lower seizure threshold, and significant caution should be taken before you start on any antihistamines. Some antibiotics, such as fluoroquinolones and carbapenems, these have been shown to lower seizure threshold, and in patients who have seizure disorder, these should be avoided in general. Azithromycin, it has not been shown to really interact significantly with many of our anti-seizure medications, and does not seem to lower seizure threshold in general. But definitely discuss with your treating neurologist prior to starting any new medications. And certain medications such as acetylcholinesterase inhibitors, anticholinergics, antiemetics, baclofen, some estrogen-based medications, methotrexate, metronidazole, some of the tramadol for pain, theophylline. A lot of these medications could lower seizure threshold. Risperidone, we're not quite sure. Wellbutrin for smoking cessation and also for antidepressant effects can lower seizure threshold as well. So discuss this with your treating neurologist, and if not sure when you're starting new medications, discuss with your pharmacist as well. And the question has been raised about Plaquenil, which again has been in the news lately a lot, as there's been some anecdotal data that Plaquenil and azithromycin together can shorten duration and severity of symptoms related to COVID-19 exposure. There is some interaction with liver enzymes, and Plaquenil can in turn lower drug levels of certain antiepileptic medications such as phenytoin and carbamazepine. Nobody should really just take these prophylactically, and you should certainly notify your neurologist prior to starting any of these medications, because this is a case-by-case issue. But Plaquenil has also been reported anecdotally and in small case reports to lower seizure threshold. There are not many cases reported unto itself, but it's certainly something that we need to be aware of. My patients are being counseled on this extensively in our office, and I recommend that you discuss prior to starting one of these this regimen. Very important right now. It's another question that came up is medical cannabis and seizures right now in the setting of COVID. It's recommended in general that at this point in time, we don't really have a lot of data on the immunomodulatory effects of cannabis. We recommend to our patients not inhaling any type of substance right now, smoke or vapor, or we are encouraging all our patients that use tobacco or nicotine vaporized type products to try to avoid this if possible, as we know that this is a respiratory illness. These things definitely increase the chance of local inflammation within your respiratory tract and potentially not cause, but put you at risk for the infection and consequences related. Oral cannabis for treatment of epilepsy and certain conditions, spasticity and MS, and psychiatric type conditions can be continued. There is really no data out there right now that I could rely on that I could say is going to tip us one way or the other. Obviously, be careful with these products and drug-drug interactions. Again, this should be recommended by a physician, and you should be using these things responsibly. Dosing should be guided by a physician as well. And I encourage my patients that if they have any questions about this issue to reach out to my office, and be happy to guide them through this, especially right now with the COVID-19 crisis. Lastly, we are in uncharted territory right now, and all medical professionals are on high guard. We are encouraging our patients to stay home, to stay safe, to wash hands, to use your best judgment on how we can all prevent this from getting worse quick. We are here. We're making every effort, my staff, my office, myself, my partners, to provide a safe environment to continue to provide care for our patients and continuity of care for neurological disease, epilepsy, all my patients with MS, Parkinson's disease, dementia, migraine. It is super important to remain in contact with your treating physician, put out the fires as they arise, and we're doing everything we can to be available to you. So stay safe, stay healthy, and should anybody out there have any questions or concerns, please do not hesitate to reach out to my office, and my staff will be happy to help you. And Take care, have a great day, and thank you for listening.